Good evening, everyone, and welcome to today's webcast, ILUMYA, a biologic for the treatment of moderate to severe plaque psoriasis, sponsored by Sun Pharma. My name is Bev Bromfield with the National Psoriasis Foundation, and I will be your moderator for tonight's presentation. Before we start, I would like to go over a few items so you know how to participate in today's event. You should all be logged into GoToWebinar and see a control panel on your computer's desktop screen in the upper right corner. You have joined the presentation listening using your computer speaker system by default. This means if you can hear music through your computer, you should be able to hear the presentation. If you prefer to join over the telephone, just select Use Telephone in the audio pane and the dial-in information will be displayed. You will have the opportunity to submit questions to today's presenter by typing into the questions pane of the control panel. You may send in your questions at any time during the presentation. We will collect these and address as many as possible at the end. This webinar is being recorded, and you will receive a link to the recording after today's presentation. At this time, I'd like to introduce you to our speaker, Dr. Wendy Cantrell. Dr. Cantrell earned her Bachelor of Science and Master of Science degrees in nursing from the University of Alabama at Birmingham from 1996 to 2000, and in 2001 she earned the title Doctor of Nursing Practice. Currently, she is an associate professor at the School of Medicine, Department of Dermatology at the University of Alabama in Birmingham. She is the manager of the Clinical Research Division for the department. Dr. Cantrell has published many peer-reviewed articles on a number of dermatological issues during her 19-year practice. She is enthusiastic and dedicated to pursuing new research, new drugs, and alternative therapies in order to enhance the quality of life of patients. Welcome, Dr. Cantrell.
All right, thank you for joining. On this screen, you'll see my relevant disclosures. I've been able and had the opportunity to work with most of the biologics that are on the market today, including the medication we're going to talk about today. All right, so we're going to jump right into today's presentation, and here's an outline of what we're going to talk about. We're going to talk about psoriasis and the signs and symptoms, how to treat plaque psoriasis, and then we're going to spend the majority of the time introducing you to ILUMYA, what it is, how it works, and how it's given. We're going to talk about the efficacy that we saw in the clinical trials and what you can expect if you start taking ILUMYA, the safety information that we know of for the patients who have already taken ILUMYA in the clinical trials. And I'm going to introduce the support program, which is the access program provided by Sun, which is called ILUMYA Support. And then after that, we'll be able to hopefully get to a lot of your questions and questions and things that you would like to ask about the program and the medication. Oh, all right. So if you ever wonder what's going on with your skin when you have psoriasis, you have to look at it that it's not just skin deep. It really starts with your immune system. And moderate to severe plaque psoriasis starts well beneath the skin. It's an autoimmune disease, and that means that your body is fighting healthy tissue by mistake. In some people with plaque psoriasis, this overactive immune system attacks certain parts of the skin. And like I said, it's really much, much deeper than just what you see on the skin surface. Your body's immune system thinks that healthy skin cells have become damaged, and so it starts fighting them off, and that causes inflammation and overproduction of skin cells, which is what you see with the scaling on your skin. This causes inflammation and rapid excessive production of the skin cells, and that leads to the painful and itchy symptoms of patchy, red, scaly skin. So how do you treat psoriasis? Well, if you have mild psoriasis, you might only use topicals, creams, ointments, and lotions. But as you develop moderate to severe plaque psoriasis, you may be given pills, chemotherapy, light therapy, and biologics. And biologic is a type of treatment for plaque psoriasis that may help people who have not been able to get their symptoms under control with other types of medications. You may have even tried some of these already, but maybe you're still looking for the right treatment for you. So a different type of biologic medication. ILUMYA is a biologic medication, and what that means is that it's formulated and developed using natural living sources such as human, plant, or animal cells. And it targets a very specific part of your immune system rather than all of your immune system. And the goal is to block the molecule that makes the psoriasis worse. So ILUMYA works differently from most other biologics that you may have come in contact with. It blocks the IL-23 molecule, and IL stands for interleukin, and that's a part of your immune system to help stop the plaque psoriasis in its tracks. ILUMYA is a prescription medication used to treat adults with moderate to severe plaque psoriasis who may benefit from taking injections, pills, which are systemic therapy, or using treatment like ultraviolet light or phototherapy. ILUMYA is not for everybody. Only you and your doctor can determine if it's right for you. You should not take ILUMYA if you are allergic to any of its ingredients. ILUMYA may lower your ability to fight infection, and it may increase your risk of infection. So before starting treatment, your doctor should check you for tuberculosis or infections. And we're going to go over in much more detail some more safety information later in the presentation. So everybody with psoriasis wants to get clear skin. So we're going to talk about how you might get clearer with ILUMYA. The first step to treating psoriasis is to slow the growth of the skin cells. We know that IL-23 plays a key role in making psoriasis worse. So when the medication, ILUMYA, blocks IL-23, there's less production of other molecules which make your psoriasis work. Blocking these molecules slows down the growth of skin cells, and with less buildup of skin cells, you will notice fewer red patches and fewer scaling. ILUMYA blocks the molecule that we know makes psoriasis work. So on this side of your screen in the before area, you can see that when there is an overproduction of IL-23, there's a rapid buildup of skin cells. We know that IL-23 activates parts of your immune system which cause the skin cells to grow at an increased rate. Now, after you introduce the molecule ILUMYA, the IL-23 is blocked by ILUMYA, which leads to slower buildup of skin cells, and you will notice improvement of your psoriasis. So how is ILUMYA given? That's a very important question for patients who are considering a change in their treatment. ILUMYA is an injection that is given by your healthcare provider in their office. This means that after the initial 2 doses, you will see your dermatologist every 12 weeks, even when your skin starts to look better. The healthcare provider, probably the nurse in your doctor's office, will give your injection right underneath your skin, similar to an insulin shot, about that same depth, to the thigh, the stomach area, or the upper arm. Keep in mind that ILUMYA is not for everyone. You should have a conversation with your doctor to decide if it's right for you. So the dosing schedule. You will receive 1 initial dose at the first treatment visit, and then 4 weeks after that. And then you will begin your maintenance dosing schedule 12 weeks after that. And it will continue every 3 months for the future. So after your first year on ILUMYA, you'll receive a total of 4 doses every year thereafter. So if you break it down, if you look in the purple box here that said after you have 1 treatment every 4 weeks, so 1 treatment every 84 days, 1 treatment every 2,016 hours, or 1 treatment every 120,960 minutes. So it offers fewer doses than most other biologics for moderate to severe plaque psoriasis. So you should talk to your dermatologist if you are not satisfied with the skin clearance that you are currently achieving with your current treatment. Clear communication is a key when it comes to working with your dermatology provider. Since ILUMYA is a biologic, you will be needing to see your dermatologist several times each year. During these appointments, your dermatologist will monitor your progress that you are making with ILUMYA to help you meet your treatment goals. Together, you can discuss any new or improved symptoms to make sure you are getting the results that you desire. So now we're going to talk about efficacy and what you can expect or hope that you will achieve during treatment with ILUMYA. The photos that you will see are from real patients in our clinical trials. Within your first 2 doses and beyond that, you will be able to count on your psoriasis treatment to go the distance, delivering results that may give you clearer skin into the future. With ILUMYA, your skin may be clear within the first 2 doses, even at 12 weeks, and can remain clearer. You can see in the pictures, before treatment, this is the patient's knees, and then after 2 doses at week 12, you can see that this patient is significantly clearer. So studies show that 6 out of 10 people were clear or almost clear after only the 2 initial doses of ILUMYA. So at week 12, 6 out of 10 people had achieved clearer skin. And into the future, studies show that 7 out of 10 people had much clearer skin after 7 months of treatment. So that is after 3 doses. And even at 3 years, studies showed us that 9 out of 10 patients who had achieved at least 75% clearer skin with ILUMYA at 7 months were still had clearer skin after 3 years of treatment. So next, let's talk about safety. Sometimes safety can be a big question for patients when they want to change their medication. And it's something that you should discuss with your dermatologist when you talk to them. As you choose a plaque psoriasis treatment options, you should consider the potential side effects and discuss the potential benefits and risk of starting any new medication, including ILUMYA, with your dermatologist. In a clinical study, people who took ILUMYA had the same risk for serious infections as those who were given an injection that had no medicine in it, called a placebo. So before starting, your doctor may perform baseline tests and should check for tuberculosis. After checking, no routine lab monitoring is required unless your doctor feels that it is necessary. The most common side effects of ILUMYA include upper respiratory infections, injection site reactions, and diarrhea. These are not all of the possible side effects of ILUMYA, and you should call your medical doctor for advice about side effects or if you are worried that you are experiencing them. ILUMYA may cause a serious allergic reaction and may increase your risk for infections, so you should tell your doctor if you have any signs of an infection. So again, just to recap, what is ILUMYA? ILUMYA is a prescription medication used to treat adults with moderate to severe plaque psoriasis who may benefit from taking injections, pills, or phototherapy. So discussing safety information. What is the most important information that you should know about ILUMYA? You should not take ILUMYA if you've had a severe allergic reaction to ILUMYA or any of its ingredients. You should get medical attention right away if you show the following symptoms of a serious allergic reaction. If you feel faint, have trouble breathing or throat tightness, swelling of your face, eyelids, lips, mouth, tongue, or throat, or chest tightness or a skin rash. ILUMYA is a medication that may lower the ability of your immune system to fight infections and may increase your risk of infection. Providers should check for infections and tuberculosis before starting ILUMYA and may treat you for tuberculosis if your TB test was positive before you begin treatment with ILUMYA. Your healthcare provider should watch you closely for signs and symptoms of tuberculosis before, during, and after treatment of ILUMYA. Tell your healthcare provider right away if you have an infection or have symptoms of an infection, including fever, sweats or chills, muscle aches, weight loss, cough, warm, red, or painful skin or sores on your body, which is different than your psoriasis, diarrhea or stomach pain, shortness of breath, burning when you urinate or urinating more frequently than normal, or blood in your phlegm or mucus. Before receiving ILUMYA, tell your healthcare provider about all of your medical conditions, including all of the medications that you currently take as well. Have you have any condition or symptoms listed in the section, what is important information I should know about ILUMYA? If you have an infection that does not go away or it keeps coming back, if you have TB or have been in close contact with somebody with tuberculosis, recently received and or are scheduled to receive a vaccine or immunization, and you should avoid receiving live vaccines during treatment with ILUMYA. Now, the flu vaccine and the pneumonia vaccine are both okay during the treatment of ILUMYA, as they are not live vaccines. If you are pregnant or plan to become pregnant, it's not known if ILUMYA can harm you or your unborn baby. If you are breastfeeding or plan to breastfeed, it is not known whether ILUMYA passes into your breast milk. You should tell your provider about all of the medications that you take, including prescription, over-the-counter, vitamins, and herbal supplements. It is not known if ILUMYA is safe and effective in children under the age of 18. ILUMYA may cause some serious side effects. The most common side effects of ILUMYA are upper respiratory infections, injection site reactions, and diarrhea. Again, these are not all of the possible side effects of ILUMYA. You should call your doctor for medical advice if you're worried you're experiencing a side effect. You are encouraged to report any negative side effects of ILUMYA to the FDA. The website and the phone number is listed here. You're also encouraged to report side effects or adverse drug reactions to our drug safety department at the phone number and the website listed here. So let's talk about how you can get ILUMYA after you talk to your dermatologist. ILUMYA Support is the program which Sun Pharma has started to help patients get the drug that they need. So once you've decided with your dermatology provider that ILUMYA is right for you, you'll have access to the ILUMYA Support Lighting the Way program. The program was designed to guide you along the treatment pathway and help you understand your insurance coverage, explore your financial options, start ILUMYA quickly and easily, stay on track with your doses, and get support and useful information along the way. ILUMYA Support offers low or no-cost options for eligible patients. If you have commercial insurance, but your coverage has been delayed or denied, you may be eligible to receive ILUMYA free for up to 2 years. There's a copay program that is available for eligible patients with commercial healthcare insurance as well. The ILUMYA Patient Assistance Program is for those who do not have enough insurance coverage or do not have insurance at all. You may be able to receive ILUMYA for free. The ILUMYA copay program is available for patients with commercial healthcare insurance. With the ILUMYA copay program, you don't need to carry the actual card. Instead, your digital copy can be accessed at ILUMYA.com at any time. As you can see here right now, it's just $5 per dose for eligible patients. So there's a 4-step process to getting access to ILUMYA Support. You ask your dermatologist to submit your ILUMYA Support Lighting the Way enrollment form. Sun Pharma and the program will confirm your prescription is covered by your insurance provider and if you are qualified for ILUMYA financial support programs. They will prepare for a call from your ILUMYA support team, and the number is listed here, or your specialty pharmacy to receive coverage benefits. It's very important that you answer your phone when an unfamiliar number pops up, because we do need to confirm with you from the specialty pharma or the ILUMYA support. Schedule an appointment with your dermatologist for your first treatment with ILUMYA is your final step. So ask your dermatologist to enroll you in the ILUMYA support program. Once your provider enrolls you into ILUMYA Support Lighting the Way, you will be eligible for personalized support, coverage information, and savings offered through this valuable support program. It is important for your dermatologist to submit the enrollment form to receive all of the benefits available to you. We will send you information about how the medication works, how it's given, helpful tips for managing your psoriasis, and your insurance coverage, and if you are eligible to receive ILUMYA at a low or no cost. Confirm your coverage options with ILUMYA. Your enrollment allows us to check your insurance company to make sure you are qualified for ILUMYA coverage and whether you are eligible for our financial support programs. ILUMYA may be covered under your medical benefits or your pharmacy benefits. This will be dependent on your insurance. In the event that your prescription is not covered, or if your coverage is delayed or denied, you may be eligible to receive ILUMYA for free with our early access program. Once your prescription has been processed by the ILUMYA support or the specialty pharmacy, we will send you your ILUMYA treatment to your dermatologist's office. You will receive a call either from your support team or your specialty pharmacy. They will let you know when your prescription will be delivered to your dermatology office. The last step is to schedule an appointment for your first treatment. Scheduling an appointment with your dermatologist or your dermatology nurse to receive your first treatment of ILUMYA with personalized support from the support system. Scheduling your treatment appointments couldn't be easier. Text the date of your first treatment to 20808 to receive your personalized dosing schedule. In summary, 3 things to remember about ILUMYA. Clearer skin that lasts. Studies have shown that the majority of patients were clear or almost clear after only 2 doses at 12 weeks. And a majority of these patients were still clear or almost clear 3 years into their treatment schedule. ILUMYA blocks the progression of psoriasis. Certain molecules in your body, like IL-23, cause psoriasis to get worse. ILUMYA works to block IL-23 so skin cells won't grow faster than normal. And lastly, it's dosing that fits your life. ILUMYA is the first IL-23 medication with just 4 doses a year after the initial 2 doses. So ask your doctor about ILUMYA today for a clearer tomorrow. So thank you for your attention, and I'm happy to answer some questions if you have any.
Hey, great, Dr. Cantrell. Thank you for a great presentation. I do have some questions for you. So the first is, can this drug be used in a mild condition to clear psoriasis?
That's a great question. This drug is approved by the FDA for the treatment of moderate to severe psoriasis. So mild psoriasis is not currently in the approved label.
Okay. How about, can it be used for pustular psoriasis?
That's a great question as well, and a very hard to treatment area. Again, this is not part of the label currently, and it's not any information that we can share on that right now.
And some people have come in with a few questions about, there's so many different choices of treatments available. How do they decide which one to use?
Well, I think having a great relationship with your dermatology provider is the key to these questions. If a patient is not happy with the clearance of their skin, then it's time to talk to their doctor about other possible options that may be available for that patient. Also, if the patient is having side effects from a medication, it may be time to talk to your provider about other treatment options. But I think communication is the key to any patient-provider relationship, and that's really key to deciding what psoriasis medication is right for you.
Are there any studies with ILUMYA around ulcerative colitis?
That's a great question as well. Right now, there is no boxed warning or about ulcerative colitis in the package insert for ILUMYA. So there is no contraindication according to the label at this time.
Have there been any studies conducted around psoriatic arthritis?
Again, it's not part of the label approved by the FDA at this time. However, I would like to refer this patient to clinicaltrials.gov, and that shows listings of the clinical trials being done right now, and there are some clinical trials being done for psoriatic arthritis with ILUMYA.
That's great news. What about risks of lymphoma and other cancers? That comes up a lot in discussion about biologics.
Yes, it does. And there is no warning for increased cancer risk in the label. So that is good news.
Are there any treatments with no side effects?
Every single medication that we take into our body by mouth or put a cream on, every single medication has side effects. I wish there were no side effects to medications, but there are for every single medication that we use to treat psoriasis. Again, this is where a great relationship with your dermatology provider is key to understanding the potential side effects that you might experience and understanding the common side effects that are not to worry about, and those that you should call your provider about.
And you had mentioned about the support program. Could you please talk about that again regarding help and paying for ILUMYA?
Absolutely. So as we know, and for those patients that have been on biologics in the past, biologics can be a challenge to pay for, and a great relationship with your dermatology provider is key to ensuring that you get access to the programs offered by Sun Pharma and get access to the evaluation of what your insurance is going to cover, what your copay might be, and in addition to what benefits you might may be eligible for in the support program. So there's copay assistance. There's making sure that if your insurance decision is delayed, to get you go ahead and start you on the medication. And there's also free or low cost medication for those who are underinsured or not insured.
Okay. We have another question here relating to another treatment. How is ILUMYA different from the weekly Enbrel injection I use now?
Well, it's a different mechanism of action, so it works very differently on the immune system. So again, that is a discussion that you need to have with your dermatology provider to see if ILUMYA is right for you.
We have a question coming in online. Why do medications work differently for different parts of the body?
Wow, that's a great question. And unfortunately, the answer is everybody's different. Sometimes people will say that for instance, some of my patients might say their scalp is more difficult to clear, but then the next patient I might see on ILUMYA might say that their elbows are slower to clear. So everybody's different on what clears quickest. The important thing to understand is that you should start to see clearance or clearing of your psoriasis as you start taking ILUMYA, and then as you continue to receive injections at first at week 0, at week 4, and then every 12 weeks thereafter, you should start to see clearing of your skin.
Okay, and if you are on ILUMYA and you are not seeing clearance, say at 4 weeks or further, what would you recommend to the patient?
Well, again, it's a great conversation to have with your dermatology provider. If you were my patient and I received a call from you at 4 weeks, I would advise that you give the medication a little bit more time. Sometimes patients need a little bit more time to start seeing clearance and clearing of skin lesions.
Okay, great. There appears to be no more submitted questions at this time. Thank you, Dr. Cantrell, for your amazing presentation. This webinar has been recorded and will be shared with attendees. You will also be receiving an evaluation survey that will be sent to the email you registered for the webinar with. Please take a moment to fill this out on behalf of the National Psoriasis Foundation, Dr. Cantrell, and Sun Pharma. Thank you again for attending ILUMYA, a biologic for the treatment of moderate to severe plaque psoriasis webinar. Have a wonderful evening.